Hi, my name is Allie Shannon. I'm one of the Army Public Health Nurses here at Irwin Army Community Hospital. How are you doing today? I'm doing good, thank you. Well, we were notified by Geary County Public Health Department that you had tested positive. Okay, yeah.
Once a disease process is identified, a positive case, we need to figure out, based on that disease, so if we talk more specifically about COVID-19, we need to figure out who has that individual been in contact with and close contact for the last 14 days.
Did you start having?
When we say close contact, that could be household individuals, that could be work, related contacts, and again, close contact. Who has been directly engaged with someone that is positive, has been less than 6 feet for greater than 10 or 15 minutes. Those are the individuals we really need to focus on.
How many people did you work with on that shift? You worked with 2 others? And then what were their names?
It's really to reduce the fears and the anxieties of the individuals, to keep them from coming to work is what our goal is. How do we get the information to the people that truly need it so that we can not have the contacts of that positive case come into work? And it's really a team effort to say, hey, who can help us with this by notifying these individuals so that we can focus on the patient care aspect of it. And it is about staying home from work. It is about monitoring their symptoms. Anybody that is a close contact of somebody positive, what we're looking for is it's 14 days that they may develop symptoms or may not. And we have to look at when was the last time you were in contact with that person. So we've had cases, hey, the last time I was in contact with him was 3 weeks ago. Oh, well, guess what? No problem. You're not feeling ill? No, I've had no issues, no concerns. Okay, guess what? No need to restrict your movement. You are totally fine. Hey, I've had contact with them within 7 days. Okay, you're already 7 days past the concern period. So you just need to watch out for yourself for another 7 days. And so it's really looking at, for each individual contact, where have they had that contact with that individual? And it does take time.
Hi, ma'am. This is Wayne Darso, nurse practitioner with the Fort Riley Public Health Department. I am just contacting you because of some information we received from the neighboring health department. I understand that you tested positive in the community for COVID-19 approximately 3 days ago. Is that correct?
I would say, it's not just about talking to that patient, it's also the documentation piece within the medical record and then notifying appropriate leadership channels. We did share that contact tracing back with Geary County so that they could make sure, hey, I have all this information correct. So total process from time of notification of positive to, hey, I think we're good, we don't need anything further, I would say at minimum about 3 to 4 hours. At most, maybe upwards of 6 to 10 for one individual or a team of individuals to do that.
For more than 10 minutes, closer than 6 feet. Those would be what we would call close contacts.
If you were less than 6 feet within that individual for greater than 10 minutes, did you have a mask on? If they say yes, then the suspicion of concern is a lot lower. Were you taking precautions to wash your hands and minimize touching surfaces within that shared open space? If the answer is yes, was the individual sneezing, coughing, look sick to you? Those kind of things we really have to drill down on. Does that individual need to restrict their movement?
To ensure that if they do get sick, they don't infect anyone in the community. Who do you currently live with in your household?
Often you may have individuals that only have a few family members, and then your close work contacts are about maybe 5 to 10 routinely. Now, we haven't had a case that has had more than typically the average of 20, although we have had a few individuals say that has not done the travel, or that has done, I apologize, outside of the 70 miles. That individual, I think, had over 30, and of those 30, about 15 of them, their work contacts were positive as well. And that contact tracing alone took upwards of 6 hours just for that one individual.
And then when did those symptoms start? Those started a week ago? Okay, and it started with
If we have a positive case and there's a delay of hours can even mean the difference of somebody going to the grocery store, right? Or somebody going to an event that they shouldn't have, or going and maybe not taking the amount of precaution had they known you were identified as a positive case contact.
Okay, it showed up on the 4th. Okay, and how high did that fever get?
We always offer them a way to follow up with either medical entities, public health entities. If it's not us, if it's Geary County or Riley County, if they're going to need to seek care, how can you do that, right? If it's the COVID screening line, or if it's, hey, what did Geary County or Riley County tell you? Just verifying that information so that when they're getting off the phone and they're like, wow, I really wish I had more information on this, they have a way to reach back.
So we're talking April 26th.
And even if it's an individual that's being tracked or monitored by Geary County, with one of our positive cases, I could tell that the individual was very nervous, very scared. And so when her restriction of movement time came up, I just gave her a courtesy call and said, hey, you know what, you're done. Your symptoms, did you have any? And she said no, and she was very appreciative of just that follow-up. And so it's kind of that human element to make sure that they have everything that they need.
Have you been in the last 14 days? So this is the part where it may get a little tricky. I know everybody's kind of working from home, going